Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hi, I am Dr. Manoj. I am an ENT surgeon practicing in Gurgaon. So I'll be wanting to speak today on the management of vertigo. Vertigo is something which is very common in our day-to-day practice, basically meaning chakkar aana, having spinning sensation, feeling like unable to walk in a straight line or falling on one side or the other. So these symptoms, a lot of patients do come into our clinic and show us with these kind of symptoms. There are also a lot of vague symptoms like feeling heavy headed, light headed, feeling something like there is some pressure on the head, or feeling that the entire world is spinning around. It can be associated with vomiting, it can be associated with sometimes ringing in the ear as well. So there is a dilemma on how to treat such patients. Many a times we are going to first look into the entire history given by the patient, any medication the patient is currently taking on, how bad the symptoms are, has he had or the patient had any history of such symptoms in the past or not. Then comes into the investigation to it, wherein we do certain clinical examinations before going into proper detailed studies like CT, MRI. Further, we will do some clinical examinations. Based on that, when we diagnose that the patient is actually suffering from vertigo, which is basically originating from the balance system organ, which is there in the innermost part of the ear. Basically, it's an inner ear problem. The patient has been diagnosed with issues related to vestibular issues, and that is what is causing him or her the symptoms of giddiness, vertigo, as they say. Then, based on that, we go into treating that patient, which may include certain exercises being done, wherein we are basically diagnosing the patient with certain canalolith happening in the vestibular system, which we reposition them into their normal positions. We also a lot of time give them medications where the pharmacological treatment comes in, and therein comes in where we are using certain medications like cinarizine, beta histine. Most commonly, we are using these two combinations in day to day practice. So, coming to cinarizine, we usually give those patients the medication for at least a few weeks. It acts by basically reducing it is a calcium channel blocker. So, it will help reduce the pressures in the inner ear system. So, we use them in Meniere's. A lot of patients, elderly patients coming in with Meniere's problem, we put them on for about 3 to 6 weeks, putting them on cinarizine as well as beta histine to help reduce and treat these problems in a proper sense and give them a long term relief rather than a short term treatment wherein we are just settling down their symptoms for a couple of days, which can come back again. We don't want that. And then we would want the patients to follow up back, let us know how they have been responding. If the patient by chance is not responding to these medications, then in there we go for detailed examinations of the balance system. Basically, including in that, we do video nystagmography or VNG, which is commonly called as VNG testing, wherein the patient, the eyes are covered with proper video recording is being done when the patient is being moved about and the balance system is being stimulated. So we are looking at all the eye movements which are being recorded. Even the minutest movement is recorded by those machines. Based on those particular tests, we then diagnose what is the problem happening. But these are usually kept only for patients who are not responding initially to our medications. The important thing is for us to help the patient settle down, comfort the patient, because many a times the patient will lose the confidence in getting up or walking about because the first episode is very, very strong and they completely lose their confidence in walking because they always think, "Ki I'll be having the same episode whenever I try to walk." So we need to counsel them well. We need to help them psychologically that these things will settle down. The medications will come in and help us, and also certain precautions in our day to day activities like lifestyle changes, reducing their salt intake will help in giving them proper long term cure. As I said, medication in this is a big, big part for us ENT specialists or vertigo specialists to help the patient being treated with problems like vertigo. Also, in this, there might be certain extreme cases wherein surgery may also be helpful. But these are very, very minute number, about 3 to 5%. And for that, a proper diagnostic workup has to be done, a thorough diagnostic workup has to be done. All the conservative procedures have to be exhausted. Only then we consider a surgical intervention for such patients. This is about how we treat vertigo, and that will be all. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.